The pregnant body, second trimester. Trimesters are a helpful way to think about pregnancy because the changes that happen to the body and the baby fall into three broad categories: the first, second, and third trimesters. The second trimester represents the middle part of your pregnancy, from weeks 13 to 26. As the uterus continues to grow, you may feel some discomfort or aches as the uterine ligaments begin to stretch. You will start to feel your skin stretch around your belly and breasts, which may cause mild itching. Keeping the skin hydrated might help soothe itching. Some women also get stretch marks in these areas. But don't worry, most stretch marks tend to fade over time. You may also notice some weight gain during the second trimester. The blood volume increases during pregnancy, and the demands of all the growth that is happening inside of you means you will gain some additional weight. The average weight gain in the second trimester is around 13 pounds. Feelings of anxiety are not uncommon for pregnant women. In fact, some women will experience symptoms of a condition called anxiety disorder. Also, antenatal depression is a mood disorder that includes intense emotional changes beyond those that you might expect during pregnancy. If you suspect any of these mood changes, talk to your doctor right away. By the end of the second trimester, your fetus will be about 13 to 16 inches long and weigh 2 to 3 pounds. Your baby will be able to move freely within the amniotic sac in your uterus. By about week 19, you may feel this movement as a faint fluttering or tickling sensation. During these 3 months, your baby's organs continue to develop and the liver, pancreas, and kidneys begin to function. This is also the time when babies might start to suck their thumb. This can be seen in an ultrasound. By week 20, your baby can hear sounds, including the sound of your heartbeat. And they are learning to recognize your voice, even though the ears are not fully yet formed. For many women, antenatal visits will be every 4 to 6 weeks. Regular antenatal visits are an important part of staying healthy and making sure your baby is healthy. At all visits during your second trimester, you should have your blood pressure checked, and your hands and feet will be checked for swelling. You might also be weighed, have blood tests taken, and have your urine checked. Your doctor or midwife will check your abdomen to monitor your baby's growth and will listen to the baby's heartbeat. Eating well and staying active are important parts of having a healthy pregnancy. It's also good for both physical and emotional health. Light to moderate exercise during pregnancy is usually safe. Consider walking, swimming, yoga, and stationary cycling during your second trimester. However, high-impact exercises are not recommended. This is due to the risks of falling, getting hurt, or becoming overheated. Your choice of food during pregnancy is also important. What you eat during pregnancy has been shown to affect how well your baby grows, as well as how healthy your baby will be later in life. Ask your midwife or doctor about antenatal education available in your area. Consider going to classes together with your birthing partner. Not only will you learn a lot about how to prepare for labor, you'll meet people who will share their experience alongside you. It is extremely important during pregnancy to visit a dentist so that any dental issues can be detected and treated early. Pregnancy hormones cause your gums to swell and bleed. In addition, there is the possibility of developing cavities in the teeth and sores in the mouth. Mouth hygiene, including brushing, flossing, and using a mouthwash, are very important during pregnancy. Having a high blood pressure during pregnancy can be dangerous. It can lead to serious complications for both you and your baby. High blood pressure in pregnancy can restrict and complicate the flow of nutrients and oxygen to the baby, preventing normal growth. An increase in blood pressure can also result in the placenta separating from the uterus due to bleeding. This image shows a normal placenta location, with the placenta attached at the top of the uterus. In contrast, here is an image showing part of the placenta coming away from the uterus with some blood trickling down the uterine wall. Another condition can develop during pregnancy due to increased blood pressure called preeclampsia. Signs and symptoms of preeclampsia include a headache that doesn't go away, changes in vision like blurriness, flashing lights, seeing spots, or being sensitive to light, trouble breathing, pain in the upper right belly or in the shoulder, nausea, vomiting, or dizziness, a sudden weight gain of about 2 to 5 pounds in 1 week, and swelling in the legs, hands, or face. If you suspect preeclampsia, contact your doctor right away. Having an elevated blood sugar can sometimes result due to pregnancy. This condition is called gestational diabetes. This is a potentially dangerous condition and can have far-reaching adverse consequences for both mother and child. Elevated blood sugar can only be detected by doing tests recommended by your doctor. Be sure to follow doctor's instructions and get all tests as needed. Anemia is another common problem detected in the second trimester. A moderate degree of anemia is actually common in all pregnant women because of the increased blood volume. This issue can easily be managed with iron supplements. However, severe anemia can be dangerous. Iron deficiency anemia can lead to premature delivery and low birth weight. Dizziness is also common during this phase of pregnancy. If you feel dizzy, reach out to your doctor immediately to eliminate dangerous causes like high blood pressure or gestational diabetes. Some tips to deal with dizziness during pregnancy are to move slowly, don't jump out of bed or get up rapidly from a chair. Eat small, frequent meals so that your blood sugar does not fall. Stay hydrated and breathe deeply so that you get enough oxygen. As your baby grows, you are likely to have a backache because of the load on your spine that is causing it to curve. To cope with these backaches, consider wearing comfortable maternity wear, sitting on a well-supported chair, keeping your feet elevated, and learning the postures that keep your back from getting strained, and perform pregnancy exercises to keep the back strong. Urinary tract infections, or UTI, can actually be dangerous during pregnancy. Stay alert for any burning sensation or itching or pain when passing urine. Report these immediately to your doctor. In the second trimester, you will finally begin to look and feel like what you imagined a pregnant woman looks like. You will start showing a slight baby bump. You will start glowing and looking beautiful. You will finally get your appetite back and might experience hunger all the time. This is the time to attend prenatal classes. Take care of yourself, eat well, and take vitamin supplements prescribed by your doctor diligently. This is also the time to go out and shop for maternity wear, and your energy might be good enough to start a safe, low-impact exercise routine. The second trimester is often referred to as the best of the 3 trimesters of pregnancy. Thank you for watching.